The day is finally here. I am finally taking the first step to do something about the cavitations in my jaw that I've been quite sure that I've had ever since I found out what cavitations are. Pretty sure they are linked to gut issues that I've had, no matter how many years of really clean, healthy eating, supplements, gut healing stuff that I do. Still got some stuff going on, and I know there's a very big link between cavitations and the gut, or really any jaw infection problems in the gut. So I'm excited to see if that's a piece of the puzzle for me. I am here at Dr. Scott Chandler's office, biological dentist. He can tell us more about what cavitations are and all that good stuff when we get in there. But I am going to be doing initial consultation and a cone beam, which is a radiation imaging procedure. We avoid those whenever we can, but in some cases, especially when you're looking at jaw infections like this, it's my understanding that's really what you have to do. So that being said, I have with me my handy Cytodetox. I'm going to take some really big doses of this, and this has quite a bit of zeolite in it, among some other things. For soaking up radiation, I'll probably take some bentonite clay when I get home as well, but I'll take this before and then right after the images. That said, let's head on into Dr. Chandler's office and see what we have to see.
Okay, so this is our 3D X-ray, also known as a cone beam machine. And so we're going to start by taking a 3D and a 2D image. Then we'll get you back, we'll take some photographs and other X-rays, and then we'll sit down and go through everything. Does that sound like a plan?
Let's do it.
Okay, thank you.
So your chin will rest here, sitting up real straight. Good. It's just going to rotate around you. All right, so we'll have you close your eyes again and just hold still. Okay, we'll go down the hall.
Cool. Alright, so what we would like to discuss is the connection of the mouth to the rest of the body. If we think of the body as an energetic or electrical system, the Chinese made basically a power grid that they showed that goes along with like the acupuncture meridians and those kind of things.
Yes.
And it shows the teeth connected to all the different body parts. And so a lot of times we will have patients referred by a practitioner with a specific problem that they want us to check that tooth and see if there's a tooth, because something's not working in a liver or a kidney or whatever.
Yeah.
And so then we'll discuss, okay, is there something going on with the tooth? Well, the things that can electrically or energetically, I should say, be wrong with the tooth that would cause an interference or a short circuit is, number one, any metal. So anything metal in the mouth, whether it be the mercury fillings, which we know the mercury is really toxic for you,
Yeah.
or a chronic infection, or a metal crown. A lot of times people won't think the crown's porcelain on top, so it's white, and they think they have a porcelain tooth, but inside it has a layer of metal.
Metal underneath.
So sometimes that's enough of a short circuit to... Teeth are like the fuse box in your house, the circuit breaker, and if the breaker's tripped, then sometimes there's no power downstream.
Yeah. What about my lower permanent retainer? Is that?
So we always recommend getting those off.
Yeah.
They're not as bad as say a mercury filling, for example, but they are an energetic blockage. They connect the suture there that can interfere with your craniosacral movements, but more than anything, it's just a piece of metal in the mouth. So you think any metal in the mouth, and you put a cell phone up next to it, and
yeah.
you've got a nice antenna for your cell phone. Well, one that people don't think about a lot of times are the dental implants, where they've had a tooth removed, it's been replaced, and we have a titanium post.
Yeah.
Well, these titanium posts are a great antenna again, but we're starting to find a huge reaction energetically as well as systemically and are finding titanium particles migrated into distant joints. And I sort of a spinal surgeon yesterday that a lot of his work right now is removing screws and plates and things out of people's backs because they're having such a reaction suddenly to the titanium.
Oh, wow.
So I think we add Wi-Fi and the 3G, 4G, now 5G towers,
Yeah.
and we're seeing a difference in what it does to the body. So the other big thing that can cause blockages in the body besides the metal are any infections. So one of the biggest infections is a root canal tooth. So a tooth that's had a root canal, even if it looks okay on the x-ray, is chronically infected.
Yeah.
So our group of dentists have extracted 30,000 of them and have been tested at University of Kentucky, and every one of them, they were all full of bacteria. It's basically
Every
this
single root
issue
canal.
where every root canal, even if it looked fine on the x-rays.
Yeah.
And so we're concerned about those. There is a strong correlation reported by many clinicians in clinics all over the world. One in Switzerland, the Paracelsus clinic, went back 20 plus years, and 98% of their breast cancer patients had a root canal on the tooth that's associated to breast on this energy chart.
Which tooth is
And
that?
so upper molars on both sides are the breast teeth.
All right.
And then we can also get some connection from some other ones, but those are the main ones.
Yeah.
So very interesting. So the other thing that I should mention, the chronic infections that usually don't hurt, that we don't think about and that many dentists don't even know about, are called cavitations. So this is what a cavitation looks like. It's just a rotten spot inside the jawbone. And so if you think of like the inside of a rotten apple,
Yeah.
or something like that, or the inside of a rotten log, it's just mushy. And so instead of hard bone, we have this area that is really soft and it's full of bacteria.
Yeah.
We culture these all the time. Every week we send them off to get tested. We open them up, we clean out some of the bacteria, and we usually get back on the report 20 or more different strains of bacteria, sometimes some parasites. And so it's just where wisdom teeth have been removed,
Yes.
which most of us had to.
Yeah.
Not like you shouldn't have got your wisdom teeth out.
But they should. What should they have done to prevent that from happening in the first? Just clean it out better than they
Yes,
do?
clean it out better.
Yeah.
The biggest thing with most wisdom teeth is that they have a cyst around them when they're formed, and a lot of times the tooth is removed but the cyst is not removed, and so you have this tissue inside the bone that's left behind, and it just decays inside the bone. Leaves this hollow space that traps bacteria. Then you put a cell phone right next to it, and we've just got a recipe for disaster. The problem with these, two problems. One is that they're on the heart meridian. All four wisdom teeth are on the heart.
Yeah.
And so this cardiologist, Dr. Levy, has written a book recently called Hidden Epidemic, and he says that these silent oral infections are the cause of most heart attacks and breast cancers. And for the reasons that we've talked about, but for a new reason that they've discovered more recently, is on here, it talks about this rantes protein.
Rantes.
It's an inflammatory protein. CCL5 is the scientific name. But this inflammatory protein in bone is supposed to be under 250, for example. Most of the time in these cavitation sites, they're tested over 5,000. So this inflammatory protein, wherever it gets out and lands in the body, triggers massive inflammation.
Yeah.
So there's been over 60,000 papers have been written on this rantes in the last few years. And they've linked it to every cancer, every autoimmune disorder, MS, Parkinson's, you name it. And there's a strong correlation to this inflammatory protein that's just off the charts in these cavitation sites.
So, if we go in and, are you saying that, you mentioned culturing, so if we were to, I'm assuming I have cavitations, but then we go would you culture it and find out if I had that protein going on?
We don't find the protein in the culture. That's
Okay.
research they're doing in Germany that they use some test, I don't even know.
Yeah.
What we do is try to find what's the bacterial load
Yeah.
and is there anything that we need to look out for down the road.
Yeah.
We usually don't do much after we get the culture because we've cleaned them out.
Yeah.
And so what we do is we open them up, we use ultrasonics, then we'll use a laser, then we'll use ozone, then we'll use platelet-rich fibrin that we make out of your own blood particles. We concentrate your white blood cells 10 times. It makes a bunch of stem cells, and we put that in the surgery site, and the healing is amazing.
All
About
right.
80% less pain and swelling. They heal without the cavitations over 90% of the time. Versus if you don't do the PRF, when you do the wisdom teeth extractions, for example,
Yeah.
in the cadaver studies, they've shown that 90% of them have cavitations.
Yeah.
And
Yeah.
so it's a lot bigger issue than we've ever known. Really, really big ones, sometimes it takes a couple of surgeries to get them completely gone. There's a very small percentage that we come back in a year or two and say, well, let's clean it out a little bit more.
A little more work to do. Yeah.
And so that's kind of the basics of a cavitation. But because it's on the heart meridian, it blocks. It's also inner ear, it digestion.
There was some digestion stuff too, right?
Yes.
Yeah.
And a lot of these teeth are connected, you know, the stomach and large intestine and all these different areas. The front teeth, where you have your permanent retainer there, is all adrenal gland. So how you deal with stress, bladder, kidney, urogenital type stuff. That's all in that area. So you can just see the different connections between the body parts. It's really quite fascinating. So let's look at your x-rays and see if you've got any of this going on. This is a standard Panorax or Pano x-ray that most dentists will give you. The problem with these and discovering cavitations is that it's almost impossible. You can sometimes see like a shadow in this area, but it's just hard to tell for sure what's going on in these. But it gives us a big picture. It helps us see in 2D where there might be metal, like the really bright shiny stuff, it would be metal. If there's metal fillings, they would show up there. We can also see a lot of times up into the joints and some of these other areas, so we can see where the sinuses are. Yours are kind of right here on top of the teeth. But this is a fairly standard x-ray that most dentists take. So this is a 3D image, and first of all, we'll start with the cartoon version. So this reminds you of a Halloween project. It basically takes the skin and bones off, and so we just have the skin and gums, and just has the teeth and bones, the hard stuff. Well, the problem with these cavitation sites is because that bone is so soft, the bone density is really low in those areas, that this picture takes it off. So back here behind this back tooth, there normally should be bone, and it just looks like a big empty hole. You can't see any bone back there at all. And so that's an example of where you probably have a cavitation.
You're saying because you can't see any bone there, it's probably because of a cavitation?
Right, because it's so soft. Now that this has limited use to me, you know, as a clinician to discover, it just helps you kind of see what's going on.
Yeah.
So what we're looking at is about a 0.5 millimeter slice every time I stop looking, or stop the movement. So here's your back here. This is the back of your throat, and so we always look at the airway. If we see people with a really reduced airway, then a lot of times there's sleep apnea involved that can contribute greatly to the heart disease as well as diabetes and several other things. And so that's something that we always look at, because there are things we can do as dentists both to shrink the soft palate as well as appliances that we can make to help treat sleep apnea that for a lot of people work as good or better than the c-pap machine. So this is your right side, so this is on your right sinus. You've got a big layer of stuff inside your sinus. So that could be like an allergy or other things can cause this in the sinus.
So I am having a bad allergy day right now. Would that play into it at all?
It can, but usually that's not thick enough to just be, have a little bit of mucus or whatever. But these usually don't feel congested. You don't feel stuffy at all. But a lot of times they'll sit down in here for years and become more of a fungal infection than a bacteria one. And we've seen a really strong correlation to the cavitations. So back here in this wisdom tooth site is usually where we're going to find cavitation, and this really dark area right above that tooth is where this bacteria from the cavitations are leaching around. The bone is like a sponge there, and it literally looks like a sponge. And so these bacteria will move through the jaw, and they can move into other areas further away from the site. What we look at down here in this bottom right hand corner are bone density reading. This is the outside layer of bone, and so you can see there that the bone density is over 1200. You get inside the bone where the bone marrow spaces are, And you can find some lower numbers, even into slightly negative numbers. The areas where the little bony pieces are, kind of the walls, are higher density, usually several hundred. What we don't want to see are negative numbers, usually higher than negative 100, is where we would say there's a problem that we need to address in most people. So we have some wiggle room, and every dentist is different. Some think any negative number should be addressed. I think it depends on a lot of factors, what the rest of your bone looks like. You've got areas where in this scan the density is not super high, and so for you, I would like to see at least negative 100 and probably higher before we would consider surgery.
Yeah.
But you get an area like this,
Ooh.
where it's so dark, there's an empty hole, we're probably over 300, yeah, 380.
What's that, 381?
381. So that's a pretty good spot.
And that's upper.
That's the upper right.
Yeah, whenever I think of cavitation, but whenever I think of what I probably have for cavitations, I'm usually picturing the lower. But
Most people, the lower is a bigger issue.
we haven't even
We
gone
find
there
more oil built up. When we open these to clean them out, what comes out looks like, but melted butter. It looks like just this oily discharge. And in a lot of cases, we get lots and lots of oil out of the jawbone with the laser and the ozone, and we just see all this stuff just come boiling out. That's what we sample and send to the laboratory to test.
Yeah.
And we've had as high as 27 different strains of bacteria come out of one of those tests.
Wow.
Also, you can see in these areas there's very little of the rebar instead of all this little white bone. Around the teeth, there should be quite a bit of that.
Yeah.
And up in this area, there's a little bit here and there's a little bit here, but most of it's pretty hollow.
Yeah.
So you've got a lot of areas in there that are into the negatives. So that's the first one.
All right. So that was upper right.
Now on the lower right, we can see an area here on the outside where we've got really good bone,
Yeah.
more to one side, but then there's some pockets underneath there where we drop into the negative numbers again.
Not quite as crazy, it looks like. Or
No,
we're not
bottoms
noticing it?
usually has better numbers,
Yeah.
but the infections are worse when we get into it.
I see.
Kind of back in this back corner, and you can see how this bone looks the same here,
Yeah.
but clear down here, we're like positive 200-300 in that same looking type of bone.
Yeah.
But you get into this area where the wisdom teeth are, and they
Yeah.
drop into the negatives consistently.
Yeah.
So that's like a 300 point swing.
Yeah.
And this is why you have to have not just a cone beam, but you have to have the software that can read the cone beam and read the bone densities. So we have cone beams sent to us from all over the country from people who had the cone beam done and were told they didn't have cavitations. And we find 4 cavitations, and they come out and we do surgery, and they're the worst ones we've ever seen.
Yeah.
I did have a great report back from a patient the other day. A year ago, we had a patient about my age with leukemia, and had just had a scan done, had gotten all of his numbers, and we cleaned out his cavitations, and I think it was about a month or so later, he got tested again, and they could not find any signs of leukemia.
A month later.
He's out a year now, and still no signs of it, and he's feeling great, put on weight, looks wonderful.
That's amazing.
So his wife just sent us a big long thank you note the other day at the year mark.
So when you're looking at, when you say, you mentioned some of the worst cavitations you've ever seen, do you know if it's the worst cavitation you've ever seen just based on this, or is it once
No.
you get in there?
This gives us a hint, and
Yeah.
it tells us what might be there.
Yeah.
There's an ultrasound tool that we hope to get from Germany soon. That's not available in the U.S. yet, but it uses ultrasound readings instead of X-rays
Yeah.
to follow those hollow spots and to monitor them after surgery. So even with digital X-rays, there's a little bit of radiation, and we're trying to find follow-up tools that we can monitor these and make sure they heal without more radiation. So
I took my Cytodetox right before it, so
Good.
I'm protected.
now, as we go through the scan, we'll look at all these other areas. One spot that even a lot of biological dentists that do cavitations miss are when people have had premolars extracted for braces. a lot of times, even though the teeth are all together and there's not an empty space there,
Yeah.
we find a cavitation in that area where that tooth was pulled.
Huh.
And so those, instead of doing surgery, where we might do damage to the roots of the other teeth and cause teeth to die, we treat those with a laser. And for some patients, that their numbers aren't as high, or they're generally in pretty good health, they're not looking at a cancer or an autoimmune disorder, sometimes we can treat these with a laser. Externally, we shine a special laser, really high-powered laser on the area. It penetrates deep into the bone and breaks up the bacteria, opens circulation into the area. And we've done about 200 cases of that, and everybody feels better. We've had some really good reported success. We just haven't done research on it to know how well is this actually working.
Yeah.
We just know people feel better.
Yeah.
So that's sometimes is a less expensive alternative than surgery for people that can't do surgery. So as we go through the scan, we'll look at the roots of all of the teeth. Many times someone will not know that they have this kind of an infection going on, or a tooth that's died, or a root canal that's gotten infected or something, because there's no pain.
Yeah.
And that's why the cardiologist named the book Hidden Epidemic, because so much of the time there's no symptoms. So we can see again, you've got under, the sinus toward the roof of the mouth, you've got some areas with some really low bone density that may be in part cavitation bacteria that's leaching through the area. We like to see a really solid wall on the floor of the sinus, where we can really see the bone clearly.
Yeah.
Here, we're in your left sinus now, we can see that again, you've got a lot of stuff built up in there, but we don't have a really solid wall. It may be that some of this bacteria is leaching through, and that's part of what's causing this chronic junk in the sinus.
Yeah. No, it's interesting. I mean, I am generally, I feel like I should breathe better through my nose. It's always, even if I'm not like having an allergy day or a cold or whatever, it's still just feels congested.
And that could be some of this that's just always in there.
Yeah.
Part of it too could be, while we're on it, let's switch pictures here. We see part of the inside of your nose here, and the nasal passages sometimes will get swollen and inflamed with the allergies, and you're not, we'll see a lot of times on people that one side is really plugged, and the other side looks great. And so occasionally you even have to go to the ear, nose, and throat doctor and get those cleaned out.
Yeah.
Occasionally patients have to go in and get their sinuses cleaned out. But we found if they don't get their cavitations cleaned up, then a lot of times the sinus stuff just comes right back.
Yeah.
On the upper left, again, we can see this upper corner gets missed a lot. That's where the cyst is left behind the most. Again, you're over 300, 358.
Negative 343, yeah.
Look at the bottom. This one's got a little worse spot on the bottom than the other side did. So we're negative 238, 284. So for bone that's normally twice as dense there as the top bone, and we're still, negative almost 300.
Yeah.
That's going to be a pretty decent cavitation.
Good cavitation. All right.
The other thing that we see all the time is here when we're looking at the throat is we'll see calcium deposits in the tonsils, and many times we're able to treat those with the laser and get the tonsils to shrink down, because all this bacteria in the mouth, it drains down into the tonsils. And Dr. Levy talks about this in the book, because he is a cardiologist. It happened to him. He had his mouth cleaned out, he started having heart symptoms. It turned out it was his tonsils. He got his tonsils taken out, and it all went away instantly.
Good thing I already don't have any tonsils.
Yeah, me neither. So here's the other view we looked at briefly for a minute. We can look at all those same areas from different angles and get an idea of side to side how bad they are. But again, because they look so similar to other areas, if you don't have the software that can read the bone density to tell the difference, then you're just guessing. And a lot of dentists are diagnosing or not diagnosing cavitations off of the 2D x-ray, the Panorex, which is impossible. And most of them have units that don't read the bone densities, and so again, it's just a guess. Ours is a little better educated guess than most people. Luckily, we've never opened one of these up that didn't have bacteria and oil in it.
Yeah.
It's a really greasy biofilm that comes out of there, and we just clean them out till we stop seeing oil float to the surface. Then I will test them. I will energy test them and make sure that I feel the meridian turn on, and that we feel the energy flow work, and then we'll close them up and say that we're done. So from this angle, we're looking down from the top or up from the bottom, and again, you can see the teeth, we can see, the areas of where we're looking at, and it just gives us a little different view on everything. This is the airway and the throat. We're able to trace that airway and get a volume reading of the throat, and that helps with our diagnosis of sleep apnea. So that's the main point. Now we'll jump over here to your 2D x-rays. Because of the thin slicing of the 3D x-rays, they're not very good for looking for cavities. And so we still will take digital x-rays of the teeth and show, so we can see right in between them and see if there's any cavities forming or fillings that are falling apart or anything like that. When you have inflammation in the gums from the gum disease, then that inflammation will start to eat away the bone that sits underneath. And so in between the teeth, the bone peaks up in here in between the teeth. And so we can see this, we've got an angle here where it looks like it's cut off.
Yeah.
That's an area where the inflammation from the gum disease has eaten away some of the bone. And so that's some areas that, we would say there's some bone disease, some gum disease that's happening. Now in Switzerland, they saw that if they got people on a really good multivitamin and taking their minerals and things, that they could stop the gum disease without actually cleaning all of the buildup and the tartar off the teeth. Right. And that the gums would get perfectly healthy and the bone loss would stop. We've always said that it was the buildup of the tartar was probably the main cause of the inflammation. Yeah. But it's such a systemic thing. Yeah. That nutrition is probably the single biggest factor. And that if we get people all the stuff they're missing out of their nutrition, then in a lot of people the gum disease will improve dramatically without having to do a whole lot in the mouth.
Start taking all the stuff I gave to my son.
Yeah. And so what we're looking in between the teeth, and we look to see if we have any shadows where there would be a cavity forming, and yours looks great. So besides,
would just the presence of the cavitations have any contribution to the gum disease in other spots, or is it completely unrelated?
We don't know. Possibly. And the way I say that is because the bacteria that we culture out of the cavitations, most everybody has some of the primary bacteria, like a strep mutans bacteria, that is one of the main players in gum disease. And especially on the upper cavitations, and oftentimes on the lowers as well, as I start to peel the gums back from the bone, we see that the gums are grown into the bone instead of sitting on top, like the skin of a baseball. Yeah. They're actually grown into the bone like the roots of a weed. Right. And so as we pull the gums out, we see the oil from the cavitation start to leak out through. And we've even seen a lot of patients that the gums will turn yellow from this melted butter oil, and we'll see yellow spots on the gums, or we'll see all these little yellow dots inside the mouth. And so we do think that this bacteria is getting out right topically into the mouth. Yeah. And maybe one of the big players in gum disease. Huh. Because I've had patients that they brush, they floss, they do everything they can and still have progressive gum disease. Yeah. And so that could be that's part of what we're looking at. Here's, we'll also usually when we do an exam, we'll take pictures inside the mouth. This helps you see what's going on, what I'm looking at. And so some things that we can see are, here you've got some pretty severe wear on these lower front teeth. Yeah. Or you've chipped some things off, you may have had an accident and chipped a tooth. Sometimes it's just bite forces, the way your teeth wear against each other, that cause that. It can be a sign of tooth grinding in your sleep. We also see a little bit of gum recession around a few of the roots, kind of some of these areas where the gums have receded a little bit. That can also be from clenching your teeth in your sleep at night.
Yeah, I don't know that I clench at night.
Most people don't know they clench or grind. You know, sometimes your spouse will tell you. It's usually not like a really loud grinding like they can hear. It's more of just a clench and
It just
rub your teeth back and forth and it wiggles them a little bit. And yours certainly are not bad at all. They actually look really good. And really very little inflammation in the gums. So I don't know if you just had them cleaned up good when you had that exam, but
they did. I mean, it was a cleaning. Yeah.
I don't see what I would consider gum disease.
Really?
There's a few of those spots on the X-rays, but
when they were just doing the little,
they measure the pockets.
And there was a couple like 7s on there.
Yeah, that's not good.
Sometimes
it's the swollen gums around the area that makes them look worse.
Yeah.
Or those areas like we looked at on the X-rays where that bone is really slanted off.
Yeah.
That low side of that could give you some deeper pockets.
But you're saying so if I were to get the cavitations yanked out and maybe get serious about, being better about vitamins and minerals and throw some oil pulling in there that you might not need the extensive deep cleaning they were trying to get me to do.
You might not.
Okay.
And if you do it with a laser instead of just the metal instruments or the surgery where a lot of times they'll peel the gums back, clean the roots and then stitch them back up. We can do all that with a laser now without the surgery part, where we don't have to disconnect the gums from the teeth. And we see better healing, a lot less pain. There's just some amazing technology today that really helps that process. But the biggest thing comes back to your nutrition.
Yeah.
Eating good and getting those minerals and vitamins, getting your calcium and magnesium balanced. Most everybody has enough calcium. It's very rare that someone needs to supplement calcium. But magnesium is low in about 80% of our populations.
Well, I certainly eat good, but I could take a few more supplements. And I could probably, like I said, I do have some, I know I've got some gut issues, so how much am I actually absorbing?
Right.
Is the other question.
Yeah, if you got leaky gut and you don't have that fixed, then a lot of times you're just not absorbing.
Yeah.
And the funny thing about the mouth is there's a hormone that's released by your salivary glands that basically signals to the teeth to wash themselves off. And so inside the teeth is blood vessels and nerves. And that's why they hurt when you get a toothache. Well, they get the message to wash themselves off if this hormone is present. And so if they're under attack or you've just eaten or it's an acidic environment, the teeth literally push fluid out through the circulation, through the blood, out the teeth, and they wash themselves off. If you eat sugar, then through the pancreas, basically like a diabetes type thing, it reverses the fluid flow. It shuts off the hormone. It reverses the fluid flow and it attracts everything to the teeth. And so you may brush your teeth and an hour later you've got this plaque all stuck to your teeth.
Yeah.
Then your fluid's going the wrong direction. And white flour, sugar, that type of thing causes that.
Reason.
Then the teeth break down from the inside and they're not washing themselves off. They attract all the acid to them, so you get cavities from the outside, you get a weakening of the inside of the tooth, and you can get cavities really fast that way.
One more reason not to eat a bunch of sugar.
Stay off the sugar. Here we can see, your retainer where they've got it glued onto a few teeth. So getting that off will be great. We can see where you've got an old white filling that's got some leakage around it. Could just be some stains under the edge, or it could be that it's starting to get a new cavity. So we'll see when we check with the magnifying glasses here what that looks and feels like. The top one, we got a bit of a glare on the mirror, but we can see that yours are looking pretty good shape. Not a lot of dark spots or holes or anything we worry about. We don't get to see too many people with teeth as good as yours.
All right.